This patient came to see me for tooth number 30. According to the patient, tooth started to hurt and also hurt to heat and cold. She went to her dentist and her dentist said everything seemed fine. She had an old filling in the tooth and the dentist said, let's redo the filling and see what happens. That's never a good idea. If a patient complains of spontaneous pain, also pain to heat and cold, that means that the nerves, the pulp, is irreversible pulpitis. So changing a filling, redoing a filling will only damage the already irreversibly inflamed pulp tissue, will damage it even more, will make it even more inflamed. And that's exactly what happened. She said she had the filling redone and numbness wore off and the pain was even worse. So she went back to her dentist and the dentist said, okay, I'm going to send you to an endodontist. It looks like you need a root canal. So when I saw her, tooth was very tender to percussion, palpation within normal limits. Probings were 2 to 3 millimeters. So went over options with the patient. Patient said she wanted to try to save the tooth. And this is what we did today. So take a look here. Endo access, of course, rubber dam, endo access, and take a look. Tooth was cracked. Right there, you see the fracture line right there. So I went over options with the patient. We can stop right here. I can put a temporary filling in the tooth, and you can contact your dentist to have the tooth extracted. Then you can talk to your dentist about perhaps getting a dental implant or a bridge or what have you. Or the other option is that I can go ahead and do the root canal. You can have your dentist build the tooth up and crown it, and we'll see what happens. No promise or guarantees. Cracked teeth respond very unpredictably to treatment. So I went over everything with the patient multiple times to make sure that the patient understood. I removed the rubber dam so patient could talk. We talked for 5-10 minutes. Patient said, okay, just go ahead and do the root canal. I'll crown it and we'll see what happens. If it works, great. If it doesn't work, then I'll just have it removed, extracted. And here's the post-op. As you can see, everything went beautifully. 4 canal systems. The distal canals, they start separately, then they join, and then they separate again. The mesials are completely separate. Everything went beautifully. We temporized the tooth and referred the patient back to her dentist. She'll build the tooth up and crown it, and hopefully she'll have the tooth in her mouth for many years to come. But as I said, I can't promise that. I don't have a crystal ball to look into and tell the patient what will happen in the future, but that's what the patient decides.